Today I'm going to be talking about obstetrics and gynaecology training in the UK, especially how the first year can set you up as a really good foundation for the rest of your training career. My name's Remy and I'm an obstetrics and gynaecology registrar, currently in my senior years of training. I am a mum of two and I've worked less than full time at various parts of my career. I've also got various side hustles which keep me very busy, including this YouTube channel. I started obstetrics and gynaecology training in 2016, which feels like an age ago. And I want to share with you some of the things that I did quite early on in my career, things that I've seen some of my junior colleagues do, and I think that these will equip you to acing your first year and being on the right sort of step for the rest of your career. So if you're due to start your training program either in August or October this year, congratulations, you have done well to get this far. You have a training number, you have a job at least for the next 7 years if you want it. How does training work in the UK? So the basics of it are, it's a 7-year training program. Once you start at ST1, you've got a job or you've got a training number for the 7 years as long as you meet your competencies, pass the relevant exams. Since I started training, there is now an entryway at ST3, and that is geared towards people who may have done other things, might be an international graduate, and they would start at ST3 and go through to ST7. And the training on the whole is split into your senior house officer years for the first 2 years, so that's years 1 and 2. And then years 3, 4 and 5 are sort of your registrar, junior registrar, middle grade years. And then ST6 and 7 are your senior registrar years. And some people might at this stage decide to go off and do subspecialty training, research and so on and so forth. And they may then have different titles. So for all intents and purposes, you're watching this video, you're in ST1 or you might be an ST3 who is an international medical graduate and wants to know a bit more about how you can succeed in the training program. So I think ultimately nothing in life is hard. It's all simple. You just have to be committed to doing the work. The work of an obstetrician and gynaecologist, which is why you've probably chosen it, is very diverse. You've got lots of things that you can be doing, medical elements in our job, surgical elements in our job. You're looking after women in our job as well, and you're looking after them really from cradle to grave. So that means that your job is going to be varied. Your weeks are going to be varied. As I train in London, a lot of my advice would be geared to that. Most deaneries, to my knowledge, for your 2nd and 3rd year, where you're stepping up from an SHO to a registrar year, will keep you in the same unit. Other than that, you're basically changing jobs every year. And for all intents and purposes, you have a rota for the year. So my first tip is going to be get to grips with your rota. I think that is really important because we are doctors, but we are also human and we have lives and we have things to keep us busy, to keep us relaxed and to give us an appropriate balance so we can go ahead and do what is a very busy job. So once you have a rota for the year, I think it's really important that you take your leave for the year, you figure out your study leave, and you figure out where you can take adequate breaks in the year so that you can be well rested to carry on doing the job. Most rotas would be anywhere really between 45 to 48 hours. And when you start at a new trust, all trusts will have an induction process for the trust as a whole, but most departments will also have an obs and gynae departmental induction as well. And most units that I've worked in will also have like a handbook for the junior doctors or for the starting doctors, the SHOs, so that they can get to grips with what their role entails. As an SHO, you'll be covering the postnatal ward primarily, the labour ward on call, the gynaecology on call, the elective cesarean section list. So those will be kind of like the core jobs that you will have as an ST1 and maybe an ST2. And then in and amongst that, you'll have training needs or training opportunities. And typically where I see those are in the triage department. So this is quite sticky actually. So most triages that I've worked in are run by the registrars. But when I was an F2, it was run by an SHO. And I know that sometimes in units that are not necessarily in London, it might be SHO led. So that depends. If it's SHO led, then that will be one of your core responsibilities. If it's registrar led, it will be a great place for you to go to get learning opportunities, because when you are a registrar, that's where you're going to be and you're going to need to learn how that works. Having said that, the other learning opportunities will come. We're going to gynae theatres, going to antenatal clinics, gynaecology clinics, and also using up your study leave to get some scanning sessions in as well. So it's a lot of things that you kind of need to get done within the year, as well as do all the service provision that comes with the job. So most units will give you a hand book, a handy book of like common conditions, places to go, who to ask for help. And it's really crucial that you know who to ask for help. So you ask your peers, so your fellow SHOs, there might be people who've been there slightly longer than you, but you also want to ask your registrars. So registrars, either the junior ones, the senior ones, and even the consultants, because that will be your bread and butter. One thing I found about Obs and Gynae is that we're quite separate from the hospital, so you don't really engage with the mess as such. So what you find is that within our department, we just create, you know, we have a really good community and we are our own mess, so to speak. So you'll find that there's a lot of good relationships between juniors, seniors and consultants, and that sort of friendship, camaraderie, good colleague relationship stands you in good stead in your early years in order to get mentorship, help with your e-portfolio, and also help with the clinical cases as they arise. So you have to remember that this is not just your colleagues, but also like your community, really, your work community. And the deaneries are so small. So even if you're in one place for a year, I bet you'll be working with someone who's worked with someone who, when you then go to your next hospital, will know you because word gets round. So all of these things you need to keep in mind and make sure that you are being as hardworking, as communicative, as friendly as possible within your department. Make sure you're working within your own competence zone, well within your team, understanding what your roles are as an SHO, and getting to grips with your rota. Because what you don't want to do, which I've also done before, is get a text in the morning and be like, where are you? And you're like, oh, it's my day off. And they're like, no, you're down to do a long day. So definitely get into grips with your rota. So I think also in the first year, what's really important is that you get to grips with the training program. So that means getting to grips with the curriculum, the matrix, and understanding what clinical procedures do you need to be able to complete in this year, as well as how many reflections do you need to do? What do they need to be about? What cases do you need to have discussed, and what things do you need to have done, and what we call the mini clinical examination techniques, which of those do you need to have done to show that you're progressing as necessary? So although it's a year, your assessment will come up about 7-8 months into the year, and that's what they'll determine whether or not you're ready to move forward. And if you're not ready, they might have another look just a month before your next training grade. Or they might be like, oh, you're really far off, we might need to add on time to training. And you really don't want to get yourself into that position, especially so early on. So I would say make sure that you give yourself time monthly, if not weekly, to address your e-portfolio, to stay on top of things, to make sure that all your reflections are up to date, your e-learning is up to date. And in that, having said that, when you look at the matrix, you will know from ST1 to ST7, these are the skills that I need to demonstrate. So I need to be able to do a simple cesarean section. I need to be able to do a complex cesarean section. And then once you've gotten into your mind where these things fit in your training, I always advise ST1s to aim to complete your ST1 and most of your ST2 competencies within the first year. And the reason I say this is obviously me being extra. This is something I lived by as well, is when you get to ST2, about 6 months into it, you need to be thinking about, oh my gosh, I'm going to be a registrar. What you don't need to be thinking about is, oh my gosh, I still have a sign off to do. And to avoid that is to just be proactive, work ahead of the training matrix they've given you, and make sure you're at a place that you're not coming to a waypoint, the end of your training, being like, oh my gosh, I need the sign off. Whereas had you been proactive and really looked at what was needed at what stage, then you'd be able to be like, yeah, I'm on top of things. And no matter how hard you are or how proactive you are, there will always be times that things evade you, but it's best that you're aware of them now than at the end of your assessment being like, oh my gosh, I need to have time added on, I need to look for XYZ. So that would be my strong advice to you. In the training matrix, it will tell you which courses you need to do at which specific points. So the robust course, the prompt, the CTG training, things like that. And you need to make sure that you factor those into your year. No one is going to chase you to go to a training program or to attend a training course. So you have to make sure that you factor that into your year and ask for appropriate study leave. Because again, what you don't want is to be like, there's only one more robust course just before my ARCP and there was nowhere else to do this course, and your rota coordinator is saying no, there is no space, you can't do it. So you also don't want to fall into that trap. Obs and Gynae is also a career where we all have to engage with learning. Departments are really good in putting out teaching, so teaching with your midwifery colleagues, teaching about CTGs, prompt teaching, all of these things, because there is such a fast-paced profession and changing profession with new guidelines that come out left, right and centre. So you really have to engage with learning. Most departments will have weekly teaching, CTG teaching, the deanery will have teaching, and these are things that you genuinely have to take seriously and attend. It can sometimes feel overwhelming or too much, or you've seen it all before, but honestly, I just think that you have to embrace that I am going to be a lifelong learner and take it all in. And to finally end, I would say that you need to figure out when you're going to do your exams. So like I said, SHO years, junior registrar years, and those two waypoints, there are exams. So before you become a registrar, you need to have done part 1 of your exams, and you want to do this early, because again, you don't want to get to a position where, oh my gosh, if I don't pass this exam, I'm going to have time added on. And the earlier you do it, they are hard exams, the more you give yourself time to fail and to try again. And similarly, when you're in your registrar years, you need to think about, when am I going to do my part 2 and 3 exams, because again, those exams can catch you out and you don't want to be leaving them to the last minute. So I would say overall, have fun. There is a lot to learn. There's a lot to do. Lean into the support system around you, because they will genuinely carry you through the training program. Like, I cannot tell you how much I rely on my colleagues to get me through. Engage in teamwork, be nice to the allied healthcare professionals, and just get to grips with your rota, the training matrix, and making sure that you're in a position to thrive. If you want to do research, if you want to take time out of training, again, you need to figure out where you're going to fit those in. Thank you so much for watching this video. I hope you found it valuable. I hope you found it useful. If you have any comments, please leave them in the comment section below. I would love to engage with you. I would love to have a chat with you about how you're finding training so far. If you're a more senior trainee and you think there are any tips that I've missed out, please leave them in the comment section below. Otherwise, like this video, subscribe to my channel, and otherwise, enjoy your day. Peace.